hello. I'm going to put my brakes on so I don't fall off. It might happen. My name is Ashli Molinero. I am the director of the UPMC Disabilities Resource Center. I've been privileged to have this role for almost 5 years at this point. However, I have been within the UPMC system since 1994. As the director for the UPMC Disabilities Resource Center, my primary role is to ensure that our patients, families, and staff, and anyone who comes to our facilities has access to all of our goods and services and healthcare that we offer. This has been a really interesting experience for me. When I took this role, I did not recognize that in my own education background at the University of Pittsburgh, when I was working with the Rehabilitation Engineering Research Centers on wheelchair transportation safety, telerehabilitation, spinal cord injury, multiple others, didn't realize how all of this would impact my role at UPMC. But I have pulled on every piece of this. I'll share a little bit with you. One of the things that I like about working at UPMC is that this is an organization that has core values that I'm going to recognize that probably your organizations have these same values. Quality and safety. We want to create a safe environment where quality is our guiding principle. Dignity and respect. We treat all individuals with dignity and respect. Caring and listening. We listen and care for our patients, our health plan members, our fellow employees, our physicians, and our community. Responsibility and integrity. We perform our work with the highest levels of responsibility and integrity. Excellence and innovation. We think creatively and build excellence into everything that we do. I'm going to explain a little bit more and expand on these in a few minutes. Our obligations as a healthcare system, if you aren't aware, we have nearly 40 hospitals at this point, over 600 physicians' offices. We have our cancer centers, our urgent cares. Our office is the one that you call if you have a disability-related issue in any one of our facilities. We work with folks to make sure that they understand the Americans with Disabilities Act and what our obligations are there. The Rehabilitation Act, you heard about Section 504 a little bit. Sections 508 and 510. 508 has to deal with digital accessibility and website compliance. 510, medical and diagnostic equipment. The Affordable Care Act, Section 1557, again, making sure that people have access to health care. You could have the best health insurance in the world. If your healthcare facility has stairs that go into the building and you're in a wheelchair, you're still not getting the best health care, right? What does accessibility look like for people with disabilities and within our facilities? We look at staff training and awareness. We look at parking. We look at physical access. We look at medical and diagnostic equipment, patient transfers, effective communication. Again, digital access and website accessibility, and service animals. What does your experience look like as a patient who's coming into our facility with a service animal? This slide, accessibility and compliance, it's a diagram of, it's an aerial diagram of an open building. It could be any healthcare facility, but it has the path of travel from the parking lot, from a bus stop, into the building, into the waiting room, into the exam rooms. The top right is a picture of a piece of medical and diagnostic equipment that's been designed to allow an easy transfer for a patient who is using a wheelchair. The bottom right diagram is really what some of our architects and planners look at. It's the accessible space for a bathroom. What does it look like when you're a patient with a disability who comes into the hospital and you need to have a patient room that has room for your wheelchair just to use the restroom? The 4 focus areas that I have are education and training our staff. You wouldn't believe it, but this education goes beyond just UPMC staff. If I told you that I had a meeting with Pepsi Corporation to talk about the height of the soft drink machines in our cafeterias and what that meant for the families and people who were coming in, right? You wouldn't expect that from a healthcare company, but there we are advocating with an organization like Pepsi and Nabisco, and vending machines. Facility accessibility. How are you getting into our facilities? Are our parking lots safe for you? Are you able to get in? Are you coming through the front door? Are you coming through the side doors? Do we have electronic door openers? Do we have accessible bathrooms for you? Policy development. Do our staff know what the ADA means in our policies? Are we allowed, what are your patient rights as a person with a disability? Community engagement. We have an advisory council who we work with, and we pull them in. Everything that we do at UPMC, we don't put anything on the floor unless we put it through our advisory council and our clinical staff. This has been a really rewarding experience for me, and if I could just stress one thing, when you talk about technology and innovation, excellence and innovation, and you think about healthcare, sometimes, yes, it is that $200,000 machine that is going to, allow us to give you the proper diagnosis. Sometimes it's as simple as a $1 surgical mask that has a clear panel that allows a person who is hard of hearing the ability to read your lips between the doctor and the clinician. That little piece of innovation was developed by a person with a disability who was hard of hearing and was in a situation that scared her. And she finally realized that just by changing that little panel that goes across the mouth made such a huge difference for people. So when you think about accessible healthcare, it is big things, but sometimes the low tech has the highest impact too. And that's what we try to make sure that we're using. Thank you.